everybody, welcome to the first of Teach It Tuesday. So I've been asked to show you some really early stages post-op hip strengthening exercises. So what would I prescribe in the first 1 to 3 weeks post total hip replacement or post FHNE? So the aims of our rehabilitation within these early stages is to try and increase natural weight bearing through that operated limb. A second aim is to reduce the risk of the digital flexor tendons from becoming short and tight. And our third aim is to try and encourage as much functional use of that hip in these early stages as we can. So there's generally 3 exercises that I like to prescribe in the early stages. So the first exercise is in standing. We're going to just demonstrate some weight shifts onto the operated leg. So you've got your patient in square standing as much as you can. What we're trying to encourage with the operated limb, so for example if this was the operated limb, we're trying to encourage that paw flat onto the floor. Then with our gentle weight shift exercise, we're just putting some pressure on the opposite hip and weight transferring onto the operated leg and off again. So on and off again. On and off again. So these are really gentle weight shifts, or sometimes they're called rhythmic stabilisation exercises. As we're pushing the weight onto the operated limb, we're contracting all those deep hip stabiliser muscles, and we're encouraging weight bearing down, correct weight bearing down through the paw. The second exercise that I like to prescribe is just getting them to start functionally using that hip and asking their dog into a square sit position. Okay, so again, what we're looking for with the sit position, sit, good, is we're trying to encourage the normal flexion through that hip, stifle and tarsus, and we're trying to encourage equal weight bearing through the left and the right hip, so from the operated hip to the non-operated hip. That's the second exercise, is just to practice a square sit. Really nice and easy in those early stages. The third exercise is just to prevent the superficial digital flexor tendons from getting tight. We're going to just look at a really nice gentle stretch. So just asking the dog down into side lying. Then with the operated limb and support through the stifle, we're just going to put the pressure underneath the paw, and we're taking those superficial digital flexors into a nice lovely stretch. So that's the third exercise I would prescribe. I would encourage the owners to be doing these exercises 3 to 4 times a day along with their prescribed walking programme. Hope you enjoyed Teach It Tuesday. If there's anything that you would like to learn or want me to go through, then let me know in the comments